Daybreak with Vivek Sanil and Muriel Desar.
You know everything about me.
Talk 100.3.
9:34 ऑन द क्लॉक. विवेक और म्यूरल आपके साथ हैं. एंड यस, ऐसे हमने थोड़ी देर पहले आपको कहा था कि हमारे साथ बहुत ही इंटरेस्टिंग डॉक्टर होने वाले हैं. डॉक्टर ऋतुराज विदेकर, स्पेशलिस्ट ऑप्थेल्मोलॉजी फ्रॉम फकी यूनिवर्सिटी हॉस्पिटल, हमारे स्टूडियो में है. गुड मॉर्निंग डॉक्टर, अ प्लेजर टू हैव यू इन आवर स्टूडियोज.
Well, good morning to you and good morning to your listeners as well.
Well, thank you for taking time, firstly, Doctor, coming to our studios. Now, first things first, not very many people understand what comes under the word ophthalmology.
Well, ophthalmology is a general term. Nowadays, the ophthalmology field itself has been subspecialized into multiple fields, which are like cornea, phacosurgeries, vitreoretinal surgeries, oculoplasties, glaucoma. So, it has a lot of each and every tissue of the eye is now subspecialized into, a different specialty altogether, and there are specialists who can provide you care for that.
Absolutely. Now, you're part of Fakeeh University Hospital and you've been treating patients for a very long time. So, could you talk to us about your association with the hospital?
Well, I have joined Fakeeh University Hospital. I have been in UAE for almost more than 9 years, and as such, my experience, is more than 25 years in the medical field. Basically, my core subspecialty as such deals with medical and surgical management of various retinal diseases.
Right, absolutely. Now, the common question that I'm sure you'd be getting asked is, when should we actually visit you? Should we visit you when our vision is all blurry, or should we have regular checkups with...
Perfect, yeah. So actually the thing is, the retina is the most important tissue of the eye, all right, and which is responsible for vision. And it is a nervous tissue which cannot regenerate if it's affected by the disease. So that's the reason why screening is very, very important. Especially for myopic patients. Myopic patients means patients who are having minus numbers. They need to undergo regular screening. Patients who are having diabetes, patients who are elderly, because diabetes is so rampant nowadays. So diabetic retinopathy is a big thing, and we can basically treat diabetic retinopathy by its early detection and treatment. The same goes true for the age-related macular degeneration, which is nothing but age affecting the retina. Initially, there was no treatment options for it, but nowadays, yes, there are treatment options in the form of intravitreal injections, lasers, so on and so forth.
So, Dr. Rituraj, you mentioned about two diseases. I think, are there more retinal diseases that you treat?
Yes, of course. Primarily, I specifically spoke about diabetic retinopathy and age-related macular degeneration, but my core subspecialty, as I told you, is surgical retina, which involves treatment for retinal detachment, treatment for macular surgeries. Retinal detachment, as you know, is a severe disease of the eye which involves a hole in the retina, and it leads to loss of vision if not treated on an at the earliest.
Absolutely. You've got to help me understand this concept. Someone said the moment you visit an ophthalmologist, you are bound to get specs. And I said, why? Because it doesn't matter how great your eyesight is. Aap visit karte ho, and then you're put in with a number. Is it true?
It's actually not true. Many times what happens is we ourselves don't pay attention to our eyes. In fact, that's very, very strange. Right. Because our life is all around 20 feet around us, and when we actually look into our actual vision, what it should be, then we specifically come to know that we do have certain amount of refractive correction, and that's the reason why you tend to get glasses when you visit an ophthalmologist. But yes, they are not happy to prescribe you, but it's for your own benefit.
Now, there is a rule, I think it's the 2020 rule, if I'm not mistaken. So could you elaborate a little bit more about this as
Perfect.
a specialist?
Yeah, with the present day work on the systems, there is something which is coming up which is known as computer vision syndrome. And the computer vision syndrome basically is nothing but strain on the eye because of work on the system for prolonged times. Of course, we cannot get rid of the system work. Is as such, ideally the system work should not be more than 6 to 8 hours, but that's not possible in the present day. So 20-20-20 rule basically states that for after every 20 minutes of work, take a break for 20 seconds and try to focus something at a distance of 20 feet.
Right.
So that will help you to relax your eye. At the same time, that will help to keep your focusing power, which we call as accommodation power, active.
Absolutely. Now, a lot of children are bound with screen time. Parents are already fighting this, and it's become a huge challenge. I've seen a 2-year-old with glasses, and as though she looked cute, but it was not really a good news for the parents. So, are there any ways that we parents can help reduce the screen time for children?
Well, there should be a joint interaction between the parents, between the educational authorities as well, and between the care providers, because as you rightly said, the screen time keeps on increasing for children. To be very frank, we need to specifically give breaks in between. That would go in a long way, rather than blanketly telling that reduce the screen time.
And how harmful is this screen time जो आप बच्चों को दे रहे हो? How harmful is it?
Well, when we look at the screen, what is emanating from the screen is the blue light.
Okay.
All right, this blue light induces dryness of eye, and dryness of eye particularly leads to irritation and redness, and in turn, it leads to further problems like allergy, itching, and so on and so forth. So it's kind of a trigger for various diseases.
Absolutely. We will continue our conversation right here with Dr. Rituraj. If you have any questions, send them in quickly on 0586861003.
This is Talk 100.3.
9:43 on the clock. A very good morning to you. We are joined in on a conversation with Dr. Rituraj Videkar, Specialist Ophthalmology from Fakeeh University Hospital. And we're talking to him about our eyes and why it's important to pay attention to it right now. Now, Doctor, we got a message that has just come in.
From Jason, पूछ रहे हैं वो कि can you ask whether after doing LASIK surgery should we have retina checkup and how frequent?
Yeah, perfect. So very nice question. Actually, as you know, LASIK basically is used, LASIK surgery is to treat the myopia. Okay. So what we do in LASIK surgery is we remodel the cornea in such a way that the number goes away. So myopia is a disease of the whole part of the eye. Even the retina basically is involved because of myopia. And coming to the question, even after LASIK surgery, a yearly checkup for the retina examination is necessary, because we have not replaced the retina and the weakness in the retina persists. What happens in myopia is that the retina gets thinned out and there can be cracks and holes in the retina, which usually, before LASIK, we take precautions that we take care of those cracks and holes prior to advising LASIK. However, since the retina is not changed, there is always a chance that new cracks, new holes can come up. And that's the reason why a yearly examination is mandatory even after LASIK.
Absolutely. Now, Doctor, what causes my vision to change year on year?
Usually the vision changes during the growing age, but after a certain, age, it remains stable. So the vision remains stable after like 20 years and on. Very rarely the refraction keeps on changing. But once you hit 40, the accommodation power of the eye reduces, and that's the reason why for after every decade you keep on adding +1 diopter for accommodation, and that's the reason why the number keeps on changing. The accommodation basically is nothing but the focusing power of the eye, which we use while reading something on the system. So that is the thing which tends to get affected.
So does lifestyle change affect your eyes majorly? Like, for example, we were told have carrots, have milk, it really works for you, foods that can work for you.
Of course. So it helps in reducing the vitamin deficiencies. Lifestyle change and going green and eating red and yellow colored fruits would always have you the daily healthy dose of carotene, which will have you the daily healthy dose of carotene, which would be helpful for the eyes. Yeah.
Is it really bad to have glasses?
Well, it all depends upon what style you like. It's actually not that bad.
Yeah, it's not that bad, right? I mean, अगर है तो है. I mean, you cannot probably categorize people कि यार इनकी आंखें तो weak है, कमजोर है, बहुत टीवी देखा होगा इन्होंने.
It's not like
It's
that.
not.
In fact, you become more dignified, I would say.
You look very nerdy suddenly, right?
Of
People
course.
take you. Well, there's also another message that has come in.
राइट आई मीन श्वेता का तो कंप्लेन है, वो कह रही है कि सारी ऑप्थल्मोलॉजिस्ट जो है ना सारे इकट्ठा होके दे शुड कंप्लेन टू KHTA कि स्क्रीन टाइम जो है एटलीस्ट फॉर किड्स बिलो द एज ऑफ 10 उनको रेस्ट्रिक्ट करना चाहिए. मैंडेटरी स्क्रीन तो होता ही है.
Of course, what I would rather suggest is there should be a unified policy, and at the same time, what I can suggest from my own experience is that it's better to take breaks in between rather than going for the long duration on the screen. That would go in a long way.
रेटिना के बारे में हम जानना चाहते हैं. If you could explain it to us, what are the things we should know about a retina?
See, retina is the innermost layer of the eye, which is responsible for vision, and it's actually a nervous tissue. So the retina, just as for example, I can tell you which you can relate it with. For example, in a camera, analog camera nowadays, not the digital camera part, but in the analog camera, there used to be a film. So retina is nothing but the film of the eye. So if the film is damaged, then the photographs wouldn't come good. Similarly, if the retina is damaged, the vision would not be good. Even in fact, if you have a Gucci glass or if you have a expensive lens in your eye, but still the vision won't be good if the retina is damaged.
Absolutely. Now, when I'm sure you would get this question posed at you time and over again. What is there a particular age group that should come and visit you regularly?
Well, I would say that the early age group, of course, see, retinal diseases are seen throughout the age group, right from premature children where retina can get affected because of retinopathy of prematurity, to a younger age group where retina can get affected because of the myopic changes, to the middle age group, particularly if at all if the patients are having diabetes for a considerably long time. And also the older age group, because the retina can get affected with age-related macular degeneration. So it is the whole population needs to be aware that retinal diseases are not specifically restricted to only older age group. It can affect throughout the life.
Dr. Rituraj, we got a question from Atik. My wife is squint. She whenever she's tired and sleepy, her eyes become squint. We did consult with doctors. Some of them recommended operations. Some said it is Sodos squint. So, is there a need for operation or not?
See, the thing is, first of all, we need to know why the squint is happening. We need to go to the root of the problem. So, for that, just as I've told you, a complete comprehensive eye evaluation needs to be done. So in squint particularly, they say that there is a principle of 3 O's.
Okay.
All right. The first O is optics, where there is a glass correction. The second O is orthoptics, which will involve exercises of the eye. And the third O is operation. If the first 2 O's don't work, then the third O will work. Yeah.
Right.
Absolutely. Now, moving forward also, if you could answer another question that has just come in.
Right. वो question हम पूछेंगे, लेकिन आप हमें WhatsApp कर सकते हैं. If you have any questions, you can always give us a call as well. 800-81003. Questions भेजिए 0586861003 पे.
Wake me up in the morning.
Daybreak with Vivek Sanil and Muriel Desar.
You know everything about me.
Talk 100.3.
9:50 on the clock. A very good morning to you. We are still in conversation with Dr. Rituraj Videkar, Specialist Ophthalmology from Fakeeh University Hospital. Keep your questions flowing in and we'll get Doctor to answer as much as we can. The number to get in touch is 0586861003. And now we have another question that has come in from one of our listeners, and he says he is 30 years of age, doctor. He has a lazy eye now. Is there any particular treatment for this condition?
So first of all, the listeners need to understand that what is a lazy eye. All right, lazy eye, in our scientific terminology, we term it as amblyopia. So amblyopia basically means a reduction of vision without a particular organic cause. Organic cause means that there should not be any obstruction to the light reaching the retina. In the early age group, if there is an obstruction to the light reaching the retina, which might be in the form of very high glasses or can be presence of some corneal opacities or cataracts, it can particularly lead to a lazy eye. So lazy eye basically happens if the visual training of the visual apparatus is not properly conducted till the initial 12 years of age.
Right.
So once the eye is amblyopic even after 12 years, then it's very rare that you can improve the power. So that highlights the importance of a regular screening for the glass corrections for the children, so that we don't miss on the refractive errors particularly. Because if the refractive errors are not picked up at an early age, and if it goes on, I have seen many patients becoming amblyopic, and for amblyopia there is no particular treatment.
So after 30,
After 30, there is no particular treatment for amblyopia. It can be treated before that, with various ways, by occlusion, by penalization of the affected eye, and so on and so forth. Yeah.
Right. Now there is a saying that when you come of age, there is no way that you can get the best vision back. You can't get the vision back. So how do you work on that? I mean, should you work at the onset of knowing that you have a problem with your eye? Because we also have a lot of haziness sometimes in our eyes, but you can't see. It's it's very unclear. So how do you kind of approach the doctor and say that?
When we say haziness, then we need to particularly look in the cause of haziness. Most commonly it is the dry eye which makes the vision hazy, which have the treatment. But when the haziness of vision is associated with certain other symptoms like glare, that might be or some kind of loss of contrast, that can be because of an early onset cataract. For that, the early examination and treatment for that is necessary. Haziness of vision associated with metamorphopsia. Metamorphopsia means not able to see the line in a straight manner. So, for example, if you remember, when we were young, we used to write on those square line books. If those square lines,
कितना मिला है हमें उधर?
जी. So where those square line books, basically, if those lines are not exactly vertical and horizontal, then that can be an earlier indication that there can be some retinal disease.
Okay.
So if at all, if you're not seeing this line straight, then probably it's the time for you to visit a retina doctor.
Quickly, Abdul का हमें voice note आया है. I'm sure he's going to ask a question.
Hi, this is Abdul Salam. I was just listening to your radio, Dr. Rituraj. Actually, I have my daughter. She's studying in 9th, and on birth itself, she was having one lazy eye. Right eye was lazy, and it was having 1 meter vision. So I made a few treatments in India, but it didn't work out. Right now, I've just brought her to Dubai, and I'm seriously looking to have some, treatment for her. I wanted his opinion on it. She was she was having this Peters anomaly. That's what they told us. She is infected with Peters anomaly, and she's having this lazy eye. So one eye doesn't have this vision, like only 1 meter vision. So can you please ask him? I was driving, that's why I couldn't type the message.
Well, thank you, Mr. Abdul Salam, for your question. As you specified that your daughter basically was having Peters anomaly and associated amblyopia. So what happens in Peters anomaly is that there is whitening of the cornea, and just as I've told you before, any obstruction to the pathway of the light reaching the retina in the earlier age group leads to reduction of vision, and that can persist throughout life. So first of all, we need to know whether there is any other cause in addition to Peters anomaly. If there is any other cataract or something which is there, which can be corrected. So I cannot particularly give a full advice here until and unless I entirely evaluate. So I'll be very happy to provide my care to your daughter.
Absolutely. Doctor, lifestyle-related conditions like diabetes, it's said to deteriorate the condition of one's vision. How true is that?
Very true, because what happens in diabetes is that there is high sugar levels, and these high sugar levels also leads to certain increase of free radicals within the retina, which leads to damage to the retinal tissue, especially the retinal blood vessels. And the blood vessels tend to become leaky. Sometimes they leak fluid, sometimes they leak blood, sometimes they leak cholesterol.
Absolutely. We've got another message that has come in from Kush.
Always feel burning eyes and sleepy.
Yeah.
And a quick tip on how to take care of your eyes.
Of course. So, burning eyes particularly is a sign of dryness of eye. So, it encompasses the whole dry eye syndrome. So, there are few things which, in addition to the 20-20-20 rule, which I specified a while ago, in addition to that, a few things which I can tell is that while driving, don't have the blast of AC on your face, because AC is a dehumidifier, so it takes away the moisture from the eye, and that itself can be one of the factor. Because especially in Dubai, with when the traffic congestion is so much, we tend to listen to Talk 100.3 FM, and at the same time,
Oh, that's an amazing
AC
plug.
and we have the blast of AC on the face because of the weather around. So that in fact is leading to dry eye. Not listening to Talk 100.3, but because of the blast
Yeah,
of
we
the
were a
AC.
little worried for a bit.
यार हमारे जाने का टाइम हो रहा है, but Dr. Rituraj, this was such a fantastic session, and I request you अगर आप फिर वापस आ सकते हैं
Perfect.
for more knowledge
Sure,
sharing
sure,
as well.
sure.
So you are at Dubai Silicon Oasis? आप वहीं पे हो?
Yes,
Fakeeh University Hospital.
I'm with Fakeeh University Hospital. I'm a full-time retina specialist there.
How can people get in touch? Fakeeh University Hospital?
Of course, yeah.
And book an appointment with Dr.
Perfect.
Rituraj.
Absolutely. Thank you so much once again, Doctor, for
My
coming to the
pleasure, my
studios,
pleasure.
educating us and opening our eyes wide open. Thank you.